Now, research question actually is the first and very foremost aspect of any research work. Why do you do research? It's not becoming ultra-exciting and inventing a fund. Those are inventions. Research, as the word says, is research. So you search again and again into same phenomena and try to find something new which is still undiscovered or unknown. Right? You don't have to find a new medicine. You don't have to find a new structure, but it's only research, searching again and again into the phenomena and when you do it, you do the research, then in the world of medicine, when there is some uncertainty, area, if there is some uncertainty about the diagnosis of the patient, about the health problem that disease poses for the community, or about the treatment of the patient, or about the prognosis, how the patient will or will take a course, wherever uncertainty exists, there is a scope for research. So, in any area, wherever there are gaps in knowledge and uncertainty exists, a research is required to be searching again into the known phenomena and to find out a solution to those gaps which are still existing in the knowledge. That is what research is. Now, as I said, a research work should start with a proper research question, and believe me, it is one of the most important and most tedious jobs. Developing a proper research question and sure we are starting here the team of 100 published papers and more than 60 of them indexed on PubMed. And if you make a research question well, the way we just discussed, half of your problem of research is over. Half of your job is over. Only then what remains is only execution of the research. So that is to say about the importance of the research question. And let us see what is so important and what is the methodology in the research. So research question start with an idea, some interest criteria. For example, this boy, Harsh. Harsh may just get an idea from various sources. If parents will be talking, his friends will be talking, or he reads the newspaper, or he sees in the TV and sees the hero of his choice, and every day she is doing something jogging. And gets thoroughly impressed. So he gets the question, should we exercise or is exercise good? Something of that sort. Now that is too vague a thing to start a research. So then you have to break it up. This idea or this thought is to be broken down into some smaller components. One of the components would be that is running as good an exercise as we do. That's one component. Or is it that if you walk briskly for half an hour every day, do you have lesser chances of getting diabetes? The answer is breaking up. Is exercise good for it? So one thing is दौड़ लगाओ, जल्दी करो. Good question inside. क्या diabetes हो सकती है आधा घंटा चलने से? और कुछ बोलो, think something. Process of thinking, the ability to think, the ability to explore mentally is very important for becoming good researcher and for a good job. So both is very important that you should keep thinking. Now becoming good. You were saying something. But speak loud. Can you again repeat what you said?
Just ask that you have something more exercise. What exercise is good for health? What would be the questions that may arise?
What would be the
questions that may arise?
Yeah, anyone.
So that what we
I said if it is good or is running good, 150 days, 150 You walk for half an hour, you do the tasks of that. There will be many other issues.
Like, there's only one vegetarian food, a good source of protein, and the vegetarian snack.
Vegetarian and
Non-vegetarian food is a good source of protein.
what nutrition it has. Just because I said it. Exciting. Oh, very nice, very nice. If you are physically fit and you are working out, do you have better focus? Okay. Other things like study and so on. Very nice. Or also if you are working on regularly, the focus of other.
Should everyone be same type of exercise or should it be personalized according to your own conditions?
So these are
Does exercising daily boost your confidence or improve one's body image?
what is it? So that's the most important. Yeah. Now, ask about
Health effects of weight gain. Does it really stunt growth?
that is really
Does it really stunt growth? Because there was a myth that weightlifting stunts growth.
instance growth. If instance growth, you want to say that you want to study and study research question. अगर छोटे बच्चों को 8 साल का रोज की शुरू करा दो तो उतनी और भी हो जाएगा बोलो
Does it exercise affects aging?
Right?
Affects aging.
Aging. So that's yeah. That should be prolonged life. That's what you want to say. Okay, fine. So see, once you develop an area which is a very broad interest, then you start developing your brain and start breaking down that area into smaller and smaller things. Because such a big area, is exercise good, does not form a good research question. You have got to come down and get more and more specific. But then, when you really make research question, when another 1 year or so, then you will get the ICMR issue. ICMR issues बहुत सारे आए So when you start filling, you'll get a chance of filling up the forms for ICMR project and all. By the time you should have understood how the research question develops. Now, research question basically is the first, there is a certain series of very well defined steps, and the first and foremost of them is that don't let the research question, UNS question, be forced on you. This is most important. Because many times it happens when you start research, you go to your guide, you go to seniors, you go to somebody who is going to guide you, and then he says, like when I went and I started to my MD, I went to my guide and he was sitting as a suggestion topic. And he was looking at me and he had tray in front of him and there was a Turing form there. You know, I've seen Turing form. Sound basically Turing form. It's nothing else to do. What we do is when you very test. The brand is that put it together, put it on the brushword, put it on the forehead, leather, and then see reduction. You will come to know of it later on. We have a Turing form, you pick up a Turing form, say do something with this. It's a very great thing. So finally, we told him do a hair test and let's put it. So what I'm trying to say is, you get a teacher guide, you get a concept, but don't let him force his thing on you. Why you get a teacher guide is because he has experience. He or she has a lot of experience in research, and therefore he and she can modulate. Wherever you are going wrong, you can be corrected because this is probably the first time or the second time of doing research. But in case you already have some ideas, you already have some points of interest, then be frank to tell the teacher, sir or madam, this is what I like, or this is the area where I am not interested. The reason is that in case you take up, very often you take up research under duress because your teacher has told you ये करो, या funding मिल जाती है, or else somebody tells you it's a very fashionable thing, very nice topic for you, but in case you are not really interested into this, so what happens is you are not interested, you don't want to do it, initially you get forced, you continue, and after 3 months you start losing interest, and after 6 months you are ready to do the research. So most of the aborted research happens because of the fact that you never had a genuine interest in that topic and you only took it up because some sort of course or business. So the first step is be very genuine with yourself. You want to do research, you should have an interest, right? It should not be forced upon you. But simple, I think it's easy to understand. Now, second step, these are all steps. The number 2 step, once you have agreed that I'll not let a research question be forced upon you, the teacher may give you a topic. Value it because the teacher has got an experience. If I am there and if I give you a topic, I'll give you a topic of I am interested. Because of my interest, I would have done a large number of research works on that area or on that topic. And therefore, I am in a much better position to guide you in that particular area. Right? Therefore, that is why the teachers often tend to tell you. So, if a teacher has given you a topic, then try and find interest into that topic. What I'm trying to say, your internal genuine interest is extremely important. If you don't have interest, after reading, after listening to the teacher, then be frank and tell the teacher, sir, इससे नहीं होगा, मेरे को interest नहीं है. Okay, rather than continuing under it. Now, after you have not allowed the topic to be forced upon you, then the next step is find a broad area of interest. Find a broad area of interest. A broad area of interest is a very wide area. It's like a big topic. There you may overall get interested. I would like to do something in this area. So this area, broad area in the world of medicine, which is huge, but it could be urinary calculi, it could be head injury, it could be road accidents, okay, or it could be physical exercise, as we said. So these are all broad areas. And the broad areas are those areas which are very broad, and within that particular area, you'll find a lot of topics, lot of scope. And it's not a very, very specific area. So that again depends on you, that depends on your interest to find out a broad area of interest, which interests you. Like COVID-19, these are all very broad areas, and within these areas, a whole lot of all subjects can be taken up for research. Now, after you have found out a broad area of interest, the next problem, the next step rather, is to read around. Now, mark the word around. Read around the subject. So reading around means a very wide study. Not an in-depth study, very wide study. Let's say you got interested in the area of urinary calculi. You understand urinary calculi? Calculi are the formation of stones. The urinary passage. It is like urinary calculi. It is an important disease. It has got a lot of complications. It is presenting a lot of problems. Let's say just because of your interest, you became interested in urinary calculi. Just for the sake of this. So, reading around the subject means carry out a very wide study, and a wide study is carried out. You must have heard of journals. There are articles which are published in journals. So, go to the library, pick up the journals, and start reading the abstracts or the summaries. The same thing, when the article is published, it gives an abstract or a summary. Before that, see the list of the various articles that are published in the journal, and then see where all related calculi are discussed. In the same journal, somebody might have written a paper of renal transplant. Another one could be the liver function test. Then you find something urinary calculi in the results. So big market, and then after 2 articles, find something like the risk factors for urinary calculi. And then go to these particular articles and only study the summary. Every article after the topic starts with a summary. That's what we call as the abstract. Just read that, and if you find something worthwhile, interesting, keep a copy or keep your tab with you and note it down. Certain sir, at this page in this journal, it is written that they done a study about calculi in the results and found that good hydration prevents. Whatever is there, you want to write it down. But make sure at this point you don't start reading into the subject. That difference so much to understand. This is read around. It's a very wide reading. Wide reading means scanning. What you do is the last minute preparation for your board examinations, for your NEET. जल्दी देख कहीं नोट्स बनाए छोटे-छोटे समरी बनाए हैं फिर भी go to the summary of the discussion. So this reading around is a very superficial reading, but at the same time it is also very wide reading by which you cover a large number of research works which should have been in that broad area of discussion. Clear now? Now after this, after you have done a reading around the subject, so after the third step of reading around, the fourth step is now find out what is the first? Don't let the research should be forced upon you. Second was find the broad area of research. That was read around it. Read a very broad study to get a general idea, and that is done generally by going through the list of articles, identifying where all the broad area of interest is covered, and seeing the abstract or the summary. Okay. Or even the relevant textbooks which are there and seeing their summaries. Okay. Now, after you have read around the topic, you will realize that there are a large number of things which have been described, but you will find something specific which starts interesting you. You will find that by something, some work, few of the workers have worked in this area, but there is some gap still in the field. So depending on that assessment of flows, you find a specific area of interest, and say for example, within your overall broad area of interest, which was urinary calculi, let's say to develop a specific area that urinary calculi in hot environment. Urinary calculi in hot environment. It's a more specific area of interest. When you get interested in hot environment, could be in the industry. What environment could be in the deserts? What environment could be in the jungles of forests? Or environment could be in the northern part of the country, in some of the Mayapur, in Amritsar, in Lucknow, in the Lahore, all. Okay, so your specific area of interest now is now focused on, and how you develop it? It is because you realize that when you have done a broad study, when you have done a wide study of the subject, then there were some people. There were some articles which had deliberated on this. Not much, but as far as urinary calculi hot environment, maybe especially deserts is concerned, desert areas, that hardly one or two people have deliberated on it, and therefore you say, okay, I pick it up So this is now my area of specific interest. See, gradually as you read, you start with the area of interest, read, again you focus on and bring it down. What happens is by gradual reading, the first thing is that your own interest starts improving. And the other good thing which happens, I'll just tell you. Now, after you have fourth step, found a specific area of interest, let's say you have gone down to urinary calculi in what environment. Now what you do is, now the next step is, now you read into the subject. See there the difference. What you did in step 1 was, step 3 was read around. Very wide, twist. Okay. It's like you are on a sea and you scan the sea, take the steamer and keep move around here and there, east and west, north and south, and cover area of about 20 kilometers. Now 2 hours, you can get back. Okay. So that's the wide area. But now you have identified a specific area of interest, and after this, you have got to read into the subject, which in other words is not a wide reading now, it is a deep reading. How do we do the deep reading? Now you must have marked those articles published in journals where this aspect of urinary calculi in hot environment like industry, like mills, like soldiers working in deserts, or inhabitants of Arunachal Pradesh and Nagaland, and so on could have been there. Okay. So now what you do is, now you pick up these articles and read the entire article. Now you read the entire article. What were the subjects? How the study was done? What were the various data heads for aspect which is worker studied? How they calculated the data? How they measured the various variables? For example, how did they measure using calculus? Right? How will you calculate? In computer biology study, they will say that we measured urinary calculus by doing the ultrasound of the kidney, ureter and bladder area with a precision of so much. So, how they have done, what they have done, what all study has been done, you get now. Also, now go through the specialized books in that subject. So, pick up a book on surgery, open the chapter on urinary calculi, and then start reading. Open a book on urology, and you will find urinary calculus. Within urinary calculus, the section will be there. You will have 4, 5, or 6 chapters, and there you will find another chapter within that, the risk factors for urinary calculi. Read it. Read it completely and keep making the notes. Once you have done an in-depth reading, what you come to know? You come to know many things. Number 1, what the various other workers have done. What are still the gaps which still need to be filled up? Somebody might have worked in US in a hot area, but people may not have worked in India. Or in India, people may have worked in industry or mills, but they may have not have worked in the deserts of Jaisalmer. Maybe people who are training for sports and working in Jaisalmer, the studies will not have been there. So, you will come to know what all has been done in that very specific area. You will also want to know what has not been done. There are these of even with research what is gaps in the knowledge. The knowledge is there, but there are certain gaps. You will come to know what all variables they have to study. Variables in the study, what variables are, but just remember for timing, variables are all those topics. You study, for example, if you are study of urinary tract calculi, you will study the age of the person. You will study whether it is male or a female. You will study what is hot environment in which he or she is working in a hot environment or not working in a hot environment. What is the height? What is the build? What is the waist of that person? So many things. Now all these things are variables. Why they are variables? We will tell you later on. But you will come to know that what are the important variables that the other people have already studied. You will also come to know how they have studied. That is very important. You will come to know how they have made those measurements, because that is extremely important for your research. The most important thing later with research is because your measurement process should never go wrong. How to measure should correctly measure what you want to measure. And it should correctly reflect the state of affairs which It's there, not something else. This is a basic dictum of research, and you'll come to know by studying that in depth. That in-depth study will tell you as to how those various measurements have been made. Right? Clear till now? Now, after having read through the subject, now you in the step you have written down, see your literature, everything you have written down. Now you may tentative. This is tentative. Make a tentative research question. A tentative research question is not a final research question. Based on your study, based on your thing that we now, you think that this is the research question I must pursue because some people have done it, many have not done it. There are certain gaps in my knowledge. I need to fill them up with my research work, but I know how the study can be done. I know what will be the methodology of the study. I know what are the variables to be studied, and I know how these variables will be measured. So with that, now you make a tentative. It's a tentative means it is not substantive. It's not final. It is there for you to further revise. For example, in this example, what we say, you may say that inadequate hydration by way of drinking inadequate amount of water while exercising in a hot desert area in the month of June may increase the risk of urinary stones. See? Is it clear? By way of drinking less amount of water while exercising in a environment in the deserts in the month of June, which is affected by hot. The risk of so this becomes a tentative question, which you are going to write it down. So write it down. It's not vague. You must then write down on a piece of paper. In fact, everything you should keep on writing. First time you have a record of what you have read around the topic. Next you have a record of what you have read into the topic. Next you have a record of what is your tentative research question. Okay. Now after this tentative research question, now what you have to do is you have to further sharpen on you have to further this 7 no 7 further refine research question. Now, when you say refining a research question, there are certain characteristics you must know. What you see when you are defining a research question, pay attention and keep noting. A good research question will give you an idea of the following. It will give you an idea of what is the exposure will be. Just write it for yourself, I just explained to you. It will give you an idea. Deepak, we should buy new pens now. Give you an idea of what is the outcome will be. It will give you an idea of what are the potential confounding factors. It will give you an idea of the magnitude. That's right, I just explained to you. Give an idea of the magnitude of the effect that you want to discover or identify in your study in a statistically significant fashion. I repeat it. It will give you an idea of the magnitude of the effect which you want to identify in your study in a statistically significant manner. That is what we mean by this. And it will give you an idea of the general settings. The general settings of the research work, where you are going to do, among whom and so on. The general settings of the research work. You seem to be uncomfortable. ठीक है ना? Any problem? नहीं, lunch खाया? कहाँ खाया? Hostel में. What's the boys hostel? Girls hostel. Boys, naturally boys. So they not let you go in by yourself. I will know that we are the chairman of the hostels. We're trying to find out whether any boys entering the girls hostel by mistake or not. So now let us see what is exposure. See, research very broadly is of two types. A research can be descriptive research. A research can be analytical. That's understand the difference. And I'm sure you are all familiar with the very usual terms in medicine by now, because now a lot of biology actually presents medicine. So you must have heard of what is anemia. Right? Anemia. Now the anemia. पीछे सबसे पहले ना velvet also in velvet the last one all of you are velvet actually आप बोले हाँ you are the most velvet I think. So anemia क्या होता है? नीचे करके बोलो जोर से. Still like a man, like a 23-year-old man that you are. 23 or less. कितने साल के हो? 18. बोलेगा एनीमिया क्या होता है? एनीमिया less red blood cells. It's a lack of oxygen carrying capacity of the blood. It could be less RBC to upward traveling toward hemoglobin. So that is anemia. So one of the two situations. One situation is that you have in your outdoor, you are a doctor and you have any ladies coming to you, you are expecting. You are having conditions that are coming to you for the routine check. And you say, I want to find out what is, how much is anemia, by percentage, because you don't understand it, serious and let's say 1%. You want to find out what percentage of women who are pregnant and coming attending by antenatal clinic are having anemia, right? There is an outcome. An outcome is, this outcome क्या है? क्या outcome देना चाहती है? What is the outcome of this? In the study, that is the purpose. The statement that I gave.
Giving something physically important. If they are coming physically, so obviously, like ideally, you would expect a relatively lower percentage of anemia. You would want everybody to.
No, and the question was in this statement, what is the percentage of women coming to my clinic?
Just a general number that I would think.
Percentage of me. Percentage of women having anemia is out. I think we got to what to see. I think we got to see this research. For women, I would have 50% ultimately percentage. So, how much percent have anemia? So that is your outcome. In any study, every study will have outcome. Whether it's a descriptive study or it's an analytical study, every study has to have an outcome. If you don't have an outcome, that was necessarily wasting time. You have to tell you define your outcome immediately. So now tell you without that fact, let's say there are every day 1,000 people coming for graduation, and you want to see how much is HIV among those. What is the outcome? Percentage of is that is outcome. So be very clear. Think for yourself, because as I told you yesterday, the time has come when you will be subjected to problem solving exercises, and the time to start thinking yourself about what problems may come, how I will tackle it, what could be the problem, and so on is now. So spend some time in that also. Okay. Now I give you another situation. You have the same antibiotic clinic, same doctor, and same 100 women are coming for antibiotic checkup. But now you are not only finding anemia by way of measuring hemoglobin, but you are also trying to find the association between the diet, which is classified, we have classified in terms of vegetarian diet and non-vegetarian diet and anemia. Outcomes anemia. It is something added on. Now, what is added on is there is the exposure also added on. And the exposure which is added on is a curiosity that probably the hypothesis in your mind, what you have in your mind or not stated, is that probably a non-vegetarian diet has less anemia and a vegetarian diet has more anemia. That's inside your head somewhere. How would that is? You are not simply interested in an outcome, only anemia. 50% anemia and 25% anemia, but now you are interested in something else. You are trying to see an association or whether vegetarian diet is associated or more specifically you want to see whether vegetarian diet is a cause of anemia or not during pregnancy. Now what is happening is you have a hypothesis in your mind. In the earlier one, in the earlier instance, which I told you, how much is anemia in the impregnated women? You didn't have a hypothesis. You never wanted to prove a point. इससे ही हो जाता है. But you were only finding out as to how much the outcome of a given phenomenon. But now you have a hypothesis. And the hypothesis is that a non-vegetarian diet facility pregnancy में उनका anemia कम होता है. अब purely vegetarian diet होती है, तो probably anemia ज़्यादा होता है. So I am only covered probably because it's a hypothesis. It's not a final proof. Now what is this? There are two variables. In the last example, there was only one variable, anemia, and there was an outcome variable. Now there are two variables. One is the diet. This is variable because we are going to measure it in either vegetarian diet or a non-vegetarian. And there is another variable which is anemia. We measure it whether anemia. And our hypothesis is probably this is vegetarian diet leads to or is the cause of that. That is this is a classical exposure and outcome relation. Where you have an exposure variable, which is also known as the input variable. It is also known as the cause variable. We will later learn about cause and effect relationship. Cause, exposure, input, they are all the same. And the other variable is the outcome variable. You have to just think for yourself. Is this research which somebody is doing? Does this research have a hypothesis? Are we trying to see the relationship of two variables? This leads to that, this causes that, or if this is there, this is less. If that is the research, that is the analytical research. And if you invariably have an exposure variable, which will be to find out easily, and it will have an outcome variable. The other research is the descriptive research, where you are only describing the phenomenon. You are only describing anemia is 50%. Okay, but you are not having any hypothesis, you are not proving any point, you are only describing. That is also very important. And there are two directions. So one is the exposure variable, and this exposure variable is not only for anemia. All aspects of medical practice, every aspect of medical practice is subject to exposure and outcome relationship. For example, when I tell you that those people who are given COVID vaccine now, right? They develop, they are more protected or they develop more antibodies or more of them they develop detectable antibodies. Then what is this? This is an analytical study. And what is the exposure variable? Exposure. Exposure is this leads to that. So antibody is that it happens. When this happens, then that happens. When that happens, then this will not happen. For example, when antibodies are increased, it not necessarily not. It could be also a reflection also, right? So what leads to what at this point? Be very think over it. Think over it. You have to understand it. This leads to that. What leads is the exposure. In this case, COVID vaccine is the exposure. You are giving COVID vaccine, or else you are not giving COVID vaccine. And the outcome is antibody. Detectable antibody. It is either developed or detected or it is not. Whereas when I say that when you give streptomycin, the chances of cure of tuberculosis are better. So what is the exposure? When I give streptomycin injection, the chances of recovery from tuberculosis are better. What is this? Is a descriptive study or analytical study? Why? What is the exposure variable? Giving streptomycin. So the exposure, the statement goes as if somebody is exposed to streptomycin, the outcome is improved recovery from tuberculosis. You think over it, you will be able to make it. So this leads to that. If that is the thing, then you have an exposure and outcome relationship. If you don't have this hypothesis, invariably, when you talk, let's say I'll give you another example. As we see, we will study later on, that those patients who have viral hepatitis, jaundice, eyes, liver is damaged, and to hold their hands firmly like this, tell them to extend their palms and hand. What happens after the 2 seconds withdrawal? Again, and these patients who have been tremors. Those patients of viral hepatitis who have this are more likely to die within a week as compared to those patients who do not have this. Right? What is this? What is the exposure and what is the outcome? Ask it. Yeah. And jaundice is not exposure. Jaundice is there. Whether the person has traveling tremors or does not have traveling tremors, jaundice is there. So, traveling tremors are exposure, yes. Yes. If you have this exposure, that is, if you have traveling tremors, you are more likely to develop outcomes. Okay. All of them have viral hepatitis. If you don't have viral hepatitis, you don't have tremors. Okay. So there is an exposure and an outcome relationship, whether you are talking of treatment, talk of streptomycin, whether you are talking of prevention, we talk of COVID vaccine, whether you are talking of prognosis, if we just talk about tremors, or else you say, if somebody smokes tobacco, the chances of getting IgG are much more. What is the exposure? Smoking tobacco, exposure. If this happens, if you are exposed to tobacco, what is the outcome? IgG or shield heart disease, right? Heart disease is the outcome. So this is what risk factor. So whether you are talking about the risk factor, or the cause of the disease, or you are talking about prognosis, or talking of treatment, or you are talking of preventive measure, the exposure outcome relationship is there. That is known as the analytical study. If your study was only that if you have patients of viral hepatitis, then you want to see how many of them have traveling tremors. Then it becomes analytical or descriptive. Descriptive, because there is only an outcome, that is traveling tremors. But this traveling tremors is not being related in your mind. We just want to see what percent has got. So, your good research question should, when you read it, should give an idea of what is possibly the exposure variable, what is probably the outcome variable, what are the potential confounding factors. We'll have a detailed discussion on confounders later on. It's a very long issue. Just for the timing, remember that confounding variables or variables are those which create confusion in research. They create confusion in research because They are related to both the exposure variable and the outcome variable. And therefore, when you observe finally an association between the exposure and the outcome variable, somebody may say that this is the confounding variable because of which this entire thing happened. It is not because of exposure and outcome relationship. Give an example. Let's say a video study in which you prove the exposure variable was eating unsmoking cigarettes, right? So the hypothesis was that those who smoke cigarettes or smoke tobacco, they are more likely to develop oral cancer. And we showed in a study that a higher percentage of people who were smoking much more had oral cancer, and compared to those who are not smoking, much lesser of them had cancer. Fine. So our study clearly proves that smoking, tobacco is related to or is the cause of oral cancer. Fine. Any problem with this? कोई issue नहीं है, कोई issue निकाल सकते हो? Can you dig out some issue now? Say exactly. The evaluation benefits is very different. Radiation. The confounder has to be associated, as I said. The confounding variable must be associated with both the exposure variable and the outcome variable. Radiation by itself may not be associated with tobacco smoking. The habit of tobacco smoking may not be related to radiation. Outcomes. Yes, radiation is there in the oral cavity, you may have cancer. और कुछ और कॉमन चीज बोलो हैं से loudly. I'll give you more significance. Let's say alcohol. If you drink alcohol, now somebody will say, Madam, this is not because of the habit of smoking cigarette that it will not do cancer, but because most of the people who smoke cigarettes also drink alcohol, and alcohol is known to cause oral cancer. So whatever you are saying, it is actually the alcohol which causes cancer, not the tobacco. Just note there are two specific things. Alcohol is a variable which is creating confusion now. From your side, you have proved the relationship. Tobacco leads to oral cancer. But now alcohol is a variable that led to a confusion. That is what confusion is confirmed. Okay. And why it is led to confusion? Because alcohol is related to smoking. More of the smokers, more the drinkers, right? You will find people who do not smoke, very few of them drink. Those who smoke, much more of them drink. So alcohol is related to exposure, and alcohol is independently related to alcohol. Because whether you smoke or not, if you drink too much, you may get oral cancer. Okay. So there are a number of variables which are related to the exposure variable. It are also related independently to the outcome variable, and because if they are not adequately addressed in your study, if you not identify them, they deal with the issue later on. But if they have not been addressed properly in the research work, then your study will become invalid. Because somebody will say that because those are the potential confounding factors. What's some idea of confounding now? Confounding is a state of indirect relationship by a variable which is related to both the exposure as well as to the outcome variable, and its presence creates a confusion or a confounding effect of an association which has been shown regarding an exposure and outcome. Okay. So it needs to be catered. Now, magnitude effect is in your study this more complicated thing, but just understand for the time being in your research question You must be able to say because the entire sample size calculation will depend on how much magnitude you want to demonstrate with your study. So, yeah. Say loudly,
How is that going to be done? Because alcohol is something which is
I told you that it's a big topic and we have to class, we have to class on confounding or confounding. 3-1. 3-1. You have to wait for about 2.5 years. But the timing keep this with you. Okay. Because if I take, I can take it now, it will take another 4 periods for this. So, but there are ways and means. There are ways and means. But what is very important is there are many ways and means of taking care of these confounding factors. But what you must remember is at this juncture that you must be able to identify each and every confounding variable. That you have to identify. Once you have identified the confounding variables, for example, in the relationship, the study between, let's say, your hypothesis, which is smoking leads to female heart disease or not, there could be many confounding variables. It could be obesity also. It could be alcohol intake also. It could be type of personality also. Because people who are tense, they smoke more and they are in many cases going to more likely to develop ISD. Right? It could be hypertension also. It could be lack of physical exercise also. Many confounding variables are there. What is important is you must be able to identify before you start your research. You have to identify nearly all the confounding variables. Once you have identified the base in the planning stage while you are collecting the data or while you are analyzing the data, the confounding can be taken care of. That we teach you later on. But at present, you must identify. How do you identify? Identify is the process of reading into the topic. Reading into the topic, when you read into the topic in detail, what are the factors? They will tell you that, article will tell you that, group will tell you, what is discussed, the experts have done research in that area, they tell you. So this is the confounding variable. That is the confounding variable. You will person be able to take them out. And therefore, it is extremely important not to do a research just like that, but do it after adequate amount of reading around and reading into the system. To understand not only the methodology to be done, not only how measurement can be done, but also you come to know as to what are the confounding variables. You also come to know in that work if you study that how this worker has catered or controlled the confounding factor in his or her particular study. Okay. Now, magnitude effect is actually the amount of effect you want to discover in your study in a significant, statistically significant manner. Just remember that for the time being. If you are planning a research work, your teachers, the statisticians, the community Dr. Bharti will help you out in understanding how much magnitude you should be understanding, you should be planning, because your entire sample size calculation, how many persons you should be studying will depend on this. This is one of the important areas. If you specify that I want to discover a very large magnitude in a significant manner, the sample size goes small. If you specify I want to study, find out a very small magnitude in a significant manner, the sample goes up. It's something like the resilience of a microscope. So, how do you define the resilience of a microscope? Or the power of a microscope? Total 10 plus 40 plus 40 by 100 by 4. They cannot microscope. I mean, 14 to after. You will it. Why two objective or one objective? You objective. Go. You can only one. It's not to say that 5% can 10 times, 40 times. Resolution is not like that. But when you say 10x or you say 40x, 100, it's all in option 100x. The resolution and what is specific. If you are near there, but what you are trying to say and what is the correct answer is that suppose these are 2 points, these are 2 bacteria, or these are 2 cells, right? And from there, can you see these are 2 different points or not? No. Now, if I put a chashma or I give you a lens of 10 power, you may still not be able to make out that these are 2 different points. Okay. But if I give you a lens of 100, you will be able to make out. From here, I can see here there are 2 different points. So the resolution of the microscope is defined as its ability to discriminate 2 points which are lying very close to each other. Higher the magnification, more the resolution. In a 100 power microscope, even the 2 cells are lying very close to each other, they are different. On the other hand, if you are looking at 10 power, the smallest objective is, you will see you will not be able to differentiate. And that is what the resolution of the power in epidemiology is. If you want to see a effect which is very close to each other, just about 5% difference. Let's say drug X which is already available gives an improvement of 90% of the patient. Already 90% of the patients are improved, and you are coming with another drug, and which is supposed to be slightly better. So you say that at least 5% improvement should be demonstrated by this drug. So if the drug X which is available to me, it is giving 90% improvement. This drug I should get at least 95% improvement. Then only it's worthwhile, otherwise if it is giving 91% improvement and it costs you 100 times more, there is no point getting the new drug, right? So you are trying to differentiate, discriminate between 2 points which are very close to each other, 90 and 92. So what do you need? You need a very high powered microscope. And in epidemiology and research, this high powered microscope is a sample size. So high powered means high resolution microscope is a big sample size, 20,000, 25,000. If you say the existing drug, you already close, that's a 50% of the patient, and I want to detect that is 100% close to be there. So now what is happening? You are trying to discriminate between the 2 points with a huge difference. You need a very small sample, right? So basically, you should be able to write in a research question what is the magnitude of effect that you want to discover in that study of yours in a statistically significant fashion. In a statistically significant fashion, the branch of statistics is a very wide branch and will be covered with you. But for the time, just understand that. And of course, the general setting of the study. And the general setting of the study, having said that, I'll give you an example. How we write this result question. This particular aspect of urinary calculi, their prevention, what they are happening in the hot environment, for exercising, not getting adequate hydration. Who will make an effort? This is voluntary. Anyone who will make an effort. एक ऐसा क्वेश्चन बनाओ जिसमें 5 चीजें आते हैं regarding urinary calculi, exercising in hot environment, and that of hydration. Now, and from now on, you all of you, whether you are studying epidemiology or medicine or GP or surgery, start thinking for yourself. So as I said, the times ahead are going to be tough. With the new pattern exams coming, and you will have to now exercise your own brains. You will have to keep on thinking yourself. What could be the problem? What could be the solution? So now I just think of this. हमारा टॉपर कौन है नीट का यहाँ? Oh, nice. What do I rank? Around 60,000. You are the topper. और किसी क्लब से बात करो. 100 good. All right now, if I say can drinking 10 liters of water, let's say 7 liters of water, can bring in 7 liters of water per day among young athletes, among young male athletes who are actively exercising in area of Jaisalmer in the month of May, reduce the risk of urinary tract calculus formation, reduce the risk of urinary tract calculus formation by 25%. Yashika. Okay. Those are one of the ability. Last student who is sleeping. बेटा जाग जाओ, आओ आगे आ जाओ, तुम सो रहे हो ना, आराम से यहाँ सो, कम कम आ जाओ. Last bench, sitting is very good. I also used to sit in the last bench, but I never used to sleep. I used to keep on looking at the girls. But you are wasting your, the privilege of not sitting in the last seat because you are just sleeping. If you got to sleep on the first bench. तो मजा आता है. अब ये बताओ, ये जो उसमें पढ़ तो बैठ जाओ, यशिका ने जो पढ़ के बताया, उसमें एक्सपोजर वेरिएबल क्या है? What was the exposure variable? You heard what she said? Yeah. She should speak out again. चलो पास हो. तुमने लिखा है नहीं? जोर से पढ़ो जरा.
Can drinking 7 liters of water per day among young male athletes who are actively exercising just made you
In the month of May. This is the research question which I made. Exposure पूछ रहा हूँ. पहले exposure की बात करो. क्या होता है जो दूसरी चीज हो जाती है? बोलो बोलो. क्या होता है? ये होता है तो ये हो जाएगा. This causes that. उसी तरह है तो it's very simple. You have to keep on analyzing. ये होता है तो ये हो जाता है. आम खाते हैं तो मुंह से निकाल आते हैं. कहते ना I don't know how much correct it is. But many of you must have heard your grandmother's story. आम खाओ गर्मी में मुंह से निकाल आते हैं. Many of the girls ना, keep on buying players like water. So they deprive themselves of a good mango and a good family. इसका एक्सपोजर क्या होगा? Another exposure is not only arm may be sitting there somewhere. So that will not lead to pimples. It is arm money. So this leads to that. इसको बोलो क्या? What leads to what? इसमें जो क्या है? This is hypothesis. It's not true. But क्या सोचा तुमने इसमें? हैं? तो keep reading on this time. इसमें तुम ये सोच कहना चाह रहे हो कि एक्सरसाइज तो कर ही रहे हैं. एक्सरसाइज तो वो पानी पिए ना पिए जैसा मेरे हो या लद्दाख में हो या -20 में हो, एक्सरसाइज तो कर रहे हैं. तो पानी पिएगा तो स्टोन नहीं होंगे. यही कहा ना उसने. 7 लीटर पानी पियोगे तो स्टोन कम होंगे. Am I making sense? Am I making sense? There's some other sense. Study on about research. There could be one more than one exposure, but don't think about it because they are very complicated researchers. For example, for having a multi-drug trial, you are having our drug which is under investigation, let's say two drugs for COVID, and you already have another drug, remdesivir, and you have ivermectin, that also, and then you have more drugs and more drug therapy, and you are comparing, and these all become exposure variables. So for a time, don't think about it. For a time, a simple good research at the elementary level, ऐसा exposure कैसे हो? इसको बताओ क्या? पानी क्यों? Exposure is 7 liter पानी. Yeah, when you are exposed to something which is drinking 7 liters of water in a day, that is the exposure. And what is the outcome then? Urinary tract calculi. Not correct. क्या किसको? See, always analyze that entire statement. What leads to what? If there is nothing like what leads to what, it's only what? Anemia 50% है, HIV 5% है. Okay. Poverty जो है, hemoglobin का level जो ladies में आती है, that is 11 gram% on average. It's not this leads to that. It's only what? Outcome answer. ठीक है, that's a distribution. When it's an analytical study, it's an exposure and outcome, and you have to take read through and understand ये करना क्या चाह रहे हैं. खुद से पूछना मैं क्या करना चाहता हूँ. ओके, एंड आप क्या करना चाहते हैं? 5-7 लीटर पानी पियो तो यूरिनरी स्टोन्स नहीं होंगे. राइट. सो आउटकम एंड एक्सपोजर अपीयर. नाउ इफ आई ऐड ऑन टू दैट, आफ्टर कंसीडरिंग, जस्ट राइट डाउन, आफ्टर यू आर फिनिश्ड, जस्ट राइट डाउन, आफ्टर कंसीडरिंग racial differences, after considering racial differences, likely intake of auxiliary substances, likely intake of auxiliary substances. Auxiliary substances are those which produce oxalic acid crystals in the urine. That is auxiliary substances and hypercalcemia. What is going on? After the stage, so now what is the PCL? Just written down. The confounding factors in this research question are the dietary content of auxiliary substances, addition differences, and these are because if somebody racially what it is called, but there in India there are a combination of races. Different activities, religions, language, and culture. There are races which are more predisposed to developing urinary calculi, and these are the races who may be drinking more water or less water in the routine. Therefore, it becomes a confounding factor. If somebody is hyperglycemic, it becomes a confounding factor. If somebody is having a diet which is full of auxiliary substances, then it becomes a so those are the potential confounding factors. And now we will tell me what are the PCS, what are the magnitude of effect in this study. In this statement, what is the magnitude of effect that you want to discover? This will know you are putting down. उससे आगे आगे आ जाए. हाँ बोलिए. हाँ कितना है वो? हाँ, that is the magnitude of effect you want to discover in your study. You studied it. If exposure is there, that is 50 centimeter of water. Outcome is urinary tract response. The magnitude you want to discover is that with this exposure decrease the appearance of urinary tract calculi by 25%. That is the magnitude of effect you want to discover. And what are the general settings of this study? The general settings of this study are different areas of section here in the odd mass of zone among healthy males. These are the general settings of the study. Okay. This is how you make the final research question. You refine the research question, and the final research question comes like this. Why this is important? Yesterday, Professor Falke was saying, and students are coming to me, get it signed at the last moment. When it goes to bodies like SMR and all, the first thing they do is only see your research question. After that, there is the entire protocol you have written, whatever. But if the research question itself is not appealing, they think इसमें the exposure and outcome है, कुछ नहीं है. They start discussion. They just go and see in your protocol. Institution protocol without protocol नहीं. Your research question should be very well formulated. Your research question for you to pass a test that whether it should be funded by the seminar, whether it should be a approved project by the Department of Science and Technology or from any good body, the research question should be as far as possible. I won't say every year, every time, but as far as possible on these lines. It should give an idea when a person reads it, we should get a clear idea. This is the exposure that the researcher wants to identify or study. This is the outcome. These are the potential confounding factors. The magnitude of effect that he or she wants to study is so much, and the general setting are also different. Okay, that is the correct and good research question. After that, you write a protocol. Now the next step. After you have done it, now you evaluate. All you evaluate, all this you have done, you further evaluate your finalized research question. You have from your set finalized, but evaluate was this research question on 5 factors. This goes by the acronym FUNS. F stands for feasible. तो ठीक है, सब क्वेश्चन को अच्छा बना रहे तुमने, पर कंफर्म की नहीं. If you want to do a research question as a post medical student, whether in a cerebral aneurysm, it's sleeping better or clamping is better, then probably research question is very good, but it's not feasible for you. Certainly not feasible for you. It's not your stop to see whether it's clamping of the aneurysm or splitting of the aneurysm. It's not for you. It's not feasible. The most important thing in a research question, after formulating it, after defining it in all this way, is see whether it is feasible for you. And feasibility means that you should either have the technical capability of doing it, or else the help should be available. Technical help and assistance must be there to support you. Okay, fine. If there is neurosurgeon here who knows intervention, neurology also, and he does it, and you have a lot of patients coming here, then it's fine. If you say it's fine, I do this. Don't seek visibility. Or if you plan research, as talking about metabolic syndrome, then you want to do the fasting insulin there is also. And your research grant will be 10,000 rupees. Then probably you will be asking a parent to send you another 10 lakh rupees to cover the research for the research program. Other will also ask to become for the research, right? So feasibility is very, very important. Whether you have the technical know-how, whether you have the money, whether you have the wherewithal, whether you have the patience or not. It will be a beautiful research question. Again, this is something to do with a cardiac catheterization. If another patient is in okay. See whether you have the patients there, whether you have the equipment, whether you have the money available, and whether you have well-trained people around to support in the research, or you are also well trained to do that. Most important is F of feasible. P for आप बताएं डॉक्टर साहब, आप थोड़ा सो गए नहीं सो गए प्लीज रिपीट द क्वेश्चन सो गए Yes. Second thing is, you should always see that there are clear-cut guidelines now. Your research work has to pass through something known as the IEC, the Institution Ethical Committee, and it should pass all the elements of ethics. And in short, the elements of ethics means you have to very important elements. The first thing is, before planning an intervention, means if it is a drug or a therapeutic procedure, surgery, new surgery, or a new preventive measure, fine. Then, will it do any harm to the patient or not? If it is going to do a harm, then the ethical aspect comes into question. Number two, is it necessary to try out? इसे रिसर्च करना चाहते हो कि medicine, whether it's effective in respective or not. So there are now 20,000 research papers already saying it's very effective. So whether it is warranted or not. Two. Number three, will you be interfering with the confidentiality of the subjects? हमने HIV के रिसर्च की और उसके बाद में बताया पूरा सा उसको जो है सेक्शुअल हिस्ट्री और जो को सब इंस्टांट को आपने पब्लिश कर दिया। ओके, तो बेटा आपको बहुत Number four, very important, rather the most important, whether an informed consent is illegal, you won't get it in any book. Whether any informed consent has been taken, that is very essential. When you do a clinical trial or a legal research, you have to clearly explain to the subject. Every subject, look, this is what I am going to do. This is the way it can harm you. Which are potential side effects are there. These are the way that benefit you, and most importantly, that you will be selected by a process called randomization. So, if you are a subject, you may get the new trial modality, or you may get the standard treatment or a by the process of randomization, when I am doing a clinical trial, one group gets the new drug, the second group gets a placebo. And you, as a subject, may either fall in this group or in that group, and therefore that has to be told to the patient. And under signatures, the patient writes or the subject writes, I understand what has been told to me and I accept. Okay. So these are the four aspects of ethical issues. There are many other aspects, and of course, the research work is to be cleared by the institution ethical committee. R stands for relevance. Relevance है कि नहीं? आप neurosurgeon हैं, and you have a research work that I want to see whether what is the acceptance of family planning to the university vasectomy in a rural area. Research question is very good. Useful research question, but it's not relevant. कौन पढ़ेगा? Neurosurgery के generally क्या पढ़ोगे? This neurosurgeon is going to be interested in reading that sort of research. So, are a person from public health, preventive medicine, or a person from option gynecology? Yes, that is a very relevant thing for your specialty or your area of work. So, therefore, your research work should have some relevance to your day-to-day area of work or your specialty, or to those people who are going to read your published article. It should not that they just throw it away. Okay. The fourth one is N stands for novelty. It should carry some element of novelty, something new must come. Something new must come. And you should answer a question which is not research is so what. आपने रिसर्च वर्क करके दिखा दिया करेंगे इसका फायदा क्या है? Okay, something new. If you publish another research work saying that tobacco smoking leads to lung cancer, leads to lung cancer, so then there are about 20,000 articles already there. Nobody is there, no novelty. Okay, or if you say that if you exercise, then there are 110,000 chances of you dying while you are jogging and activity. So what? क्या करें? Healthy people should stop exercising, or they should get afraid fighting to member something. Then after exercise, see, everything must have something of the novelty and should answer the question. So what? सब करके क्या करना है? What is its significance for public health or for clinical practice? That answer should be there. And finally, S stands for specific. Your research work, your question should be as specific as possible. And specific means it should give an idea of these aspects. That it should give an idea of the exposure variable, it should give an idea of the outcome variable, it should give an idea of the potential confounding variables, it should give an idea of the magnitude of effect that you want to discover in a statistically significant fashion, and lastly, it should give an idea of the general settings of the study. And after you have evaluated, your research question may not pass all these criteria. It may not pass all the criteria, but should be logically passing most of the criteria. Okay. After you have evaluated, then do one more thing. You write down your research question as you have written, as I just dictated. So you write down your final research question. Just it takes one or two papers, one or two pages, one in one paragraph or a few lines, 3 or 4 lines. Write down your final research question. The next, write down what is already known. Just write down 4 or 5 lines. Various workers have worked and they have found that overall lack of hydration is a risk factor for infection and so on. What is already known, well known. Then the next paragraph is what are the gaps in the existing knowledge? What are the gaps in the existing knowledge? So you say, while it is known, as we have already said, this is known, but however, most of the studies available do not clearly indicate these aspects, because therefore these aspects are not so very clearly known by the available research. There are the gaps in our knowledge and which need to be filled up. And fourthly, right, how this research work is going to help in the existing healthcare idea of public health improvements or clinical improvements or policy. That is basically how this research work is going to help in healthcare improvements or clinical improvements or policy improvements. So every research work should lead to a dynamic change in the public health or clinical policy. That is here we have to say that in case this research work, this hypothesis is proved, then we can work out ways and means of putting extra water, potable water, safe water at the point, and ensuring that everybody drinks a glass of water after every half an hour, whatever the conclusions. But we have to clearly bring out as to how this research work is going to help us in improving our clinical practice or our public health practice or the policies that are there. Okay. And the last one, just one. Last of all, with a list of few references you have already read while reading around and reading into the subject. You have already read a number of articles, you have already read a number of books and chapters. Give a list of about 7 or 8 articles or journals. So that if you are evaluating your research question, they evaluate you. First of all, on the first page, whatever your research question is written, that itself should be eye-catching. It should have all the 5 factors which I told you. And then inside when you write the protocol, at least these aspects. In addition, if they ask you to write the protocol, right, how you will make the measurements, that also naturally has to be there. But these aspects must be there logically because once they read it, the people who are evaluating, who are going to sanction or research work, will be convinced that you have done your homework very properly and you deserve to be successful. Good. Say loudly. तुम नीचे आ जाओ, just come down.
Yeah. I wanted to ask that there has to be some novelty or anything in our research, right? But then when you have questions like the one you mentioned, like can we spend the water per day among young male athletes and we do the of so you are giving the answer in the question. So the first may not be better than doing. There can be a problem.
This is the question.
Yeah, so it may be all. So how can you?
You need not. See, a research work in today's world is not done for the entire medical fraternity. If you see the research work, it's very specialty specific. Probably who will read this? People who are into sports medicine, people who are into urology, people who are into medical medicine. So this research work is not for the comprehension of a let's say pediatrician. So first of all, the research question may not be able to satisfy everybody, all the doctors in the world, because it's very specific. That is why I said that it should be relevant to your specialty. Second thing is when it's not related, it's not that issue, it's what about something which is all, right on the so that is something that is so often with it. That people will say that that's it. Yes, research would have been done once only in the United States. Always done in the United States and maybe in the Eskimo land. This is replicate. That doesn't reduce the weight. Any amount of complexity. Not a very good thing. The way. That's what interest is concerned. Everybody will have it. Very few people can most extra on the medical fraternity. Yeah, absolutely. Have you been answered?
So I have a doubt that you said that there's uncertainty and consensus taken, right? So if not there is a placebo to someone, does that is the purpose of it? The doubt is that if I am asking a question about a placebo, then doesn't that defeat the purpose of it?
You don't have to tell him that you are going to ego. You have to tell the person who has to tell you that this is a trial which is of a new drug X. You will have patients who will be volunteering and you draw off what we call the randomization is in very simple terms lot. And I pull up a lottery, I put the lottery to get a new drug which is being tried, or it's going to get no drug, only a blessing. That is mandatory for us. To be part of the conference. If you are not getting them, then you are legal and ethical. So the conference is international. Of course, now the question is actually that many people say no, that is so. Therefore, the dropouts are expected. But the initial part is not physical part. Initial part when you have to calculate the sample, so therefore you always have about 20% extra sample. Suppose you calculate it by your research, the matter that only 20, say 100 patients and 100 controls. So basically you should add on at least 20% more. That is really at least at 240. Because any of them, at least 10-15% will not get you, let's say in the percent will become dropouts. They will start, but they will lost it forever. These things are important now. Because this will be our even the diagnostic error, how the result question itself is there. This is at least part of the question. This is not patient, placebo will not. Why? Because the placebo is either an existing modality of treatment, or it is only chalk. What's it only yes, only. Yes, let's say, walk or more between the then the same video. So the standard and the standard question. And the two intervention model. Now, the placebo should have the same size, same shape, same constitution, same modality of administration as medical. So for example, if you are trying, let's say, standard drug today by forming for life, you drug response. X for life. So you would say that either you get the blue drug or you get the placebo control. It's actually placebo control. Those are placebo control, and you drug will be given as a capsule, 2 times a day, as a white color, or you have some blue, something. And the form will be given as a placebo, standard control placebo. We also have the same color, the same size, the same shape, and also different people. So the patient is not able to make out. I'm getting the placebo, when I'm getting the actual treatment, I'm not able to make out what I'm doing. Placebo means if the same groups are the same. It's a duplicate, but the actual duplicate is the same. So if you want it, you have to duplicate standard existing. There are decisions for it to don't have. This is very COVID vaccine is a decision really because HIV came. That time it was a new drug, a zero routine, that's a new drug. Let's see. Because you can't deny a patient the existing model. The person with placebo never suffers. But you are already, either you are giving placebo metformin, you already have for 50 years, you know the side effects. Or else you are giving only vitamin C, which is does not cause any effect. Because of giving vitamin C in the placebo, because there is no more effect. So you have both the situations. One situation is you don't have anything. You have no drug. You have to do a placebo, which is not. Situation you already have a modality of treatment. So you give the modality of the placebo, and you give it. The third and is the standard of the trial. So when the trial was processing, Neural network is contained in the factory of cryptocurrencies are also converted to the same customer plan with the same shape, same color, everything doing the same process in the same way. So a patient or a doctor would not make out whether the patient, this patient is on development or is on sickle. And both the groups create equal exercise. Improvement of 50%. Right? Ciprofloxacin was then taken up because oral chemical is not on cycle. So that is also not only improvement. The data effects of the past is only one outcome. Only one action. There will be more than one experience. There will be more than one outcome. Outcome could be the cure of the disease. It could be prevention of death. Outcome could be lessening of side effects. Outcome could be low cost. There could be many outcomes. You must think that you should think on a good setting, one exposure for it. And if you have many exposures and many outcomes, they are known as the primary exposure variable and the secondary exposure variable. And you have the primary outcome and the outcome.
That was my same question. You say the doses might be different for different patients. Their previous treatment.
अगर हमारा पेशेंट जो है वो 10 तक जब आप पेशेंट को बोलो 5 to 10 years या 10 to 20 years also then you direct patient but your controls are also recognized that's understand try to understand the process very complex process but just get an idea. The randomization what happens if this is now about 120 students and you become our subjects. Out of which 20 of you say, no, why not to participate? It's not good. So much. Now these are the so the objects. First training. That you are the subject. This is what the trial is. These are the side effects actually. You will be doing this. And do that with the test. No, you will do that. So all of the remember that is all of you very number 1, 2, 3, 4, 5, 6. And very simply, the actual process is more complicated. There are random numbers. There are tables and you can get random numbers, but it more simple. All you understand, just imagine numbers 1 to 200, 1 to 100, you make checks. 1, 2, 3, 4, you make checks. You put it in a box and you shoving them there. So ask the person to come. Okay. And you take another person, pick up another. Try to pick up 14. Whatever you pick up, goes into the treatment. Without the proper it's not going to the control. So by objects we are dividing 100 people into 50 each into 2 groups. This group has the why all this exercise? Because that is what this is the botany or random what we call it the random allocation or randomization. Why your chance? It's totally random phenomenon. Nobody controls. And finally, you make the food. Randomization or randomization is that when you make divide a group or subgroups into 2 groups, and randomization and random allocation are the same. Two words are the same thing. So when you divide a group of human beings by the percentage like water, in these two groups which are formed, it is similar to each other. If you measure the height of this group and this group, the average will come to almost the same. How many percentage of boys and girls in this group? Both of us will have the same percentage of boys and girls. And not only those factors which can be measured. The factors which cannot be measured, for example, HLA the genetic constitution, you can't measure it easily. But the power of nature is that it is those factors. One is measured, the two groups will be similar to each other. Also, we creating two groups. If I absolutely similar to each other. And now we are going to do the creative people which are essentially similar to each other. Now they are going to be different from each other in one way. Because they were more healthy, or they were genetically better, or more of them were race and race recovered better. So the constitution is this. Also, remember when we talk of conforming fully conforming, the most efficient method of conforming is because it will show that the two groups are same on all factors, there is no differential distribution. So you can't say this group is having more colon cancer, or not only because they smoke more, but they drink more. So the two groups you see that get a randomization with alcohol consumption and an average to be the same. Randomization is one way of continuing cancer. It is only possible in a clinical trial. Only possible in a clinical trial. Where you are studying the efficacy of the drug, or the treatment modality, or a vaccine, or a prevention. But it cannot be done in the study of diagnostic factors or risk factors. So we study whether in case of biohazard, and for the prognostic sign of early mortality, you find that 100 patients with biohazard, we have to divide them into two, and we go to start having so when we are studying the prognosis, or study of this factor, we want to see whether a group which smokes gets more IQ than a group which does not smoke. You can't randomize people and tell this group is starting smoking, this group is smoking. You can't do that. So, in the study of risk factor, the study of prognostic factor, it is randomization cannot be done. Therefore, you have to adopt other different methods. Evaluation of the treatment modality or prevention modality, randomization is required. And that is how the clinical trial conducts. RCT. RCT which will promise the randomized control. RCT is a randomized control blinded trial.
The beneficiaries of the research is considered. But to be able to find new things and novelties, that is being very harmful. So, if research has clearly some ill effects, should it be conducted? And if yes, then which board will decide?
Not only we all should know.
So my question was, while conducting research, the beneficiaries of the conclusion is obviously regarding the plan. If it can be seen to research can have some ill effects. So should it be conducted or not? And if yes, then which body will decide that this is the limit that this amount of time? This is where you can push your boundaries.
They are talking about some harm people die. Definitely referring to the research, it is find out the new drug, a new surgical procedure, a new vaccine, a new customers price agree or not. You are not creating any harm. Nature is creating harm or not creating harm. So you are different against clinical trial. You are introducing. And you can see. Now, if you see the clinical trial, what is the two type of question you are asking? Questions you are asking. So, how to make both clinical trial is one thing before there are many things. But before a clinical trial enters the phase one, that is, the condition to that will be given by the start of phase one. So before that, you have to produce trial evidence. Studies in the animals. I've done the study on the available. Dynamics of the drug has to be popular, not a body I'm studying them. I've done the animal studies, even the animal spacecraft. These are the results. Therapeutics of chemistry. That this drug will not produce any cancers, will not produce any conversion. It will not produce any success. You also get no side effects in animals. Submit that to the drug controller. Then it will give you, now when you go to the human phase one, phase one are dosing studies. You have a small number of see that in different ways. You start with a small group, looking to the all this. After that, we come to a after this, you again get back to the right. This is a permission to start the stage 2. Evaluating not very decided. Why decided to my one is the treatment. Suppose it should be a ration. Yes, then or not, now you see that in this series of we take the class and so many recovered, so many things, so many recovered, so many things. So again, evaluate what is the side effect of whether the patient is good. Then you enter the phase 3, and the phase 3 is the classical answer. When you say RCT or clinical trial or animal, such a phase 2 of usually they say clinical. Phase 1 and phase 2 are already over. So phase 3 is the classical because that is when you randomize in the subject to people. Once you get the data, and you take the standard. And then now you see that it is so comparing the flow rate. The flow rate which was the which was the more so much percentage is there. CPI gives you permission and then you market the drug to the chemist, the chemist and the market and write it with this to be given phase two. Phase one is the post surveillance. Post marketing surveillance is almost that's what we also about the surveillance. We keep on studying the adverse drug reactions in all the patients and find out which drug that is being. And then these adverse reactions and the drugs that taken are reported to the central surveillance center. The moment there is a indication that this drug is giving rise to these side effects, the drug is immediately classical example is after the phase period, probably needed later on. The issue that very useful days. After going through the data of phase one, phase two, because the requirement of the drug is very important. The humanity, the mental needs are very immediately, and therefore, see that gives a permission to start using the drug in the market, and as the data comes, we see whether it is. Last question for some very good. How is speaking, because confidence. That will be carried out. I speak out for my health and the very much possible. So the request I speak out, but I also exercise should be very loud and because most of the lessons think that I have scored it. But the loud speaking also has to be more like confidence. And the girls don't come in.
What about opioids? Can you give us opioids?
No, opioid. Asking about opioid. Opioid. You are asking about opioid which are derivatives of morphine, are required and they are often used for codeine. Codeine used for love and they are used for pain. They are often used for release of pain. Are actually endorphins. Theory is very important. Theory is we want to understand. Endorphins are hormones which are released in the body. They have one which is like opioid. Opioid that are just free releasing. And then after this is to dysphoria. You start that is what you take a PMTPIMS. the final start when they're working on the body. Similarly, endorphins, what happens, endorphins are released in the body, right? Long physical exercise. Those people are very clear that they can't live without exercising every day. The breed of endorphins is an exogenous phenomenon. Endorphins, we can't get it from outside. The body needs endorphins that the whole brain and the effect is same as the brain. So after this meal, right, it is very confident, your brain goes away at all. So that is one of the good applications of the physical exercise. Very confident. And that is one of the reasons why patient physical exercise. Or also exciting regularly, your body is releasing endorphins. So your brain gets used to a level of endorphins, which keeps you happy always. So you have seen people who are better than exercise and all those. If they don't exercise your body, they can't get their water because they push the certain level of endorphin, and because they don't exercise the level of endorphin also. So they try to withdraw. So things happen, you are not doing they don't know what are so they have withdraw. So typically in the exercise, you also withdraw of endorphins and therefore they come up. That is withdrawal theory as far as endorphins are concerned. But other withdrawals from glucose are theory or there's no one. If you see a couple of days over the concept, you can't be seen there. They also call it. That is why only is a resistant. You can't get it wrong. So let's about COVID. Rather than the bottom you use water. Then on the doctor is available. The bottom is available. You do not get right. But then the bottom is available. Fine, thank you very much for your intense listening and interest. All of the best to you. But it's not rejection.
Now we have a last session of the day by Dr. Joshi. Professor is Department of Microbiology. So with this, welcome to the That is about English to Marathi conversion. So many students are from other states to Marathi. Marathi.
Okay. So thanks to Palcha sir, give me an opportunity to meet you people and congratulate you by passing your NEET and getting admission in Praura. So your journey started yesterday. Few topics we have to go through. Actually, this is something new for me also, this topic. It's nothing related to my subject, at least the first part of it. But still, basically, I'm also a doctor, so it's not a big deal. Simple question from any one of you. Why a patient comes to hospital? One of you. To get treatment. Huh? That's what you said. So when the patient comes to the hospital to get treatment, to reduce his pain, he does not expect you to add to his pain. Yes or no? And as a doctor, our job is to reduce his pain, treat his infection without harming him. That is what I'm going to talk today, the patient safety. We are supposed to take care of our patient when they come to the hospital. Now just see what is safety. You just remember these few words. First one is always sense the error or the mistake which may occur, which may harm your patient. Sense it. Okay, that's the most important thing. Act to prevent it. So you have to stop that mistake before it happens. If you stop it, prevent it earlier, the harm will be less. So you have to prevent it. Follow your safety guidelines. There actually are safety guidelines for each and everything in a hospital. But why the accidents occur, why the error occurs, is because we are not following those SOPs, or standard operating procedures. That's why the mistake happens. So always follow your safety guidelines. If something happened, if the accident happened, put a committee, inquire why that happened, whose mistake it was. So you have to have the inquiry on why the mistake happened, why it is important, so you can prevent it next time. Take the appropriate remedial measure. And finally, and most important one, is you accept it that it is your responsibility to take care of your patient. You are not supposed to harm your patient. Why safety in the hospital? As you said, the patients are coming to the hospital to get treated, isn't it? So they don't expect the harm from our side, one. Second thing, the patients are coming in the hospital with so many infectious diseases, isn't it? So we have to take care that infections also is not transmitted to the staff of the hospital. Another very important thing is the emotions which you will get in the hospitals. The patient's emotion, the relatives, and at the same time, the overburdened, overworked staff of the hospital. These emotions are like happiness, sadness, life, death, everything you will get. So what will happen? There is always a conflict which may occur between the doctors or a hospital staff and the patient or patient relatives. That's one of the reasons recently we have so many incidences actually, which we had seen. There had been a war sort of a situation in the hospitals with the patient relatives try to beat the doctor or ransack the hospital. So this is all because of the environment of the hospital. Now, whose safety in the hospital? Of course, we are going to talk only about the patient today, only the safety of the patient. But overall, once we are talking about the safety or patient safety, actually it become a branch of medicine now. Patient safety. In Europe, you can do a post-graduation in this, patient safety. So you have your property, which you're supposed to take care of. Nothing supposed to happen to them. Why? Because if one of your instruments is not working properly, indirectly, it's going to affect the health of your patient, because these instruments are supposed to use well. The other one is the safety of the place. Again, that's very important. You have to take care of all your appliances, electrical. A patient had come, he got admitted in the ward. I'm sure he doesn't expect a fan to fall in his head. It's an accident, isn't it? Which should not happen in a hospital. So that is another part of the patient safety, which we have to take care of it. And finally, the hospital staff, the patient, and the patient's relatives also. They are also become part of the safety program of the hospital. But again, I said, today we just talk about the patient safety with one simple example of one single mistake which had happened in the hospital, and we see how we had reached to that level and how we can prevent it. The first is just see the definition what WHO is defined the patient safety is a healthcare discipline now. First thing, remember that it's a part of your medical education that's emerged because of the evolving complexity in the healthcare system. So as the healthcare system will become more and more complex, the number of the chances of the accidents and errors by the physicians also keep on increasing. All right. So we're trying to prevent those accidents in the hospital. The final, what is the aim of the patient safety? It's to prevent and reduce the risk, errors, and harm that occurs to the patient during their stay in the hospital. The same thing with different languages. This is a definition of patient safety in the Indian textbooks. Just see the last paragraph. That is what we want with the patient safety. Please do no harm. If you cannot treat the patient, doesn't matter. Don't kill. All right? So don't harm the patient. Actually, the origin of the patient safety, we cannot believe it, is 2004. Just around 20 years back. The reason of that, again, was the complexity in the health system, increase in the number of the accidents, infections in the hospital to the patients. That's why this is started by WHO. And every year on 17th of September, they are celebrating this Patient Safety Day. But if you see, it actually starts with long back. The oath which you will take This is part of it. Whatever you are going to do with your patient, you are going to do it with a good faith, to the best of your ability and knowledge, and you are not going to harm your patient. That's the part of the oath which you are supposed to take. Now we'll go to our scenario. What had happened? A patient in the hospital has received the wrong medication because of some mix-up somewhere. Let's see. The medication starts from the prescription of the doctor, isn't it? I just put a sample prescription of a doctor there so you can see that prescription. This prescription goes to pharmacy. The pharmacy is usually in the big hospitals. If you see, they are unkept. All the medicines are right in front of you. They do not segregate their medicines properly. There is a rule in the pharmacy. Sound alike, look alike should not be ever kept together. The medicines which sound alike or they look alike, they should not be kept together. Now, if with this handwriting of a doctor, if the pharmacy is lucky enough to read it, he may pick up a wrong box, which here we are going to blame him that he has given a wrong medicine. And the medicine goes to the ward. Now the nurse is supposed to administer it. Look at that nurse. What she's doing? She's yawning. She's tired. Now, this can be one of things. Start from right that she doesn't know that drug. She was just sleepy and dump it in the patient's mouth. At the same time, don't forget, it's a responsibility of the patient also to show what he is taking. All right. So the mix-up happened. The patient received the wrong medicine. If any one of these people, doctor, a pharmacist, and a nurse, had followed the standard operative procedures, what they are supposed to do, this error, this accident could not happen. Agree? Bad handwriting of a doctor, mix-up of the pharmacist, tired nurse, all of them were involved in this accident. Yes or no? So what will happen? Generally, what will happen is, if it comes to know, if the patient, for example, will end up with some problem, they find out, yes, there was a wrong medicine given to her. A committee sits. Let's find out whose mistake it was. So most of the time, either a pharmacist is blamed or a nurse is blamed. Usually they don't blame doctors in the hospital. So you are safe that way. But remember, the whole thing starts from your handwriting. So what will happen? They find someone, they catch hold of him, they may punish him also. That is usually what is happening. But it is very unfortunate. Because the person who is going to give the punishment does not realize there had been a failure in the different layers. It was not one single person's mistake. It was a group of them which they did that mistake. Now the person who is doing that mistake, or who is accepting that he had done the mistake, this person or this act is called as the active error. Is the end point. He did the harm. But what we said, there were the layers which could have stopped this accident, which are called as latent errors. Now again, the last sentence says, where the group of the latent errors align, the accident happens. So these are the layers where it passed through, and you see, they align with each other. So the act of the accident has occurred. Why errors happen? I won't say the fellow doesn't know what he's supposed to do. We say they are overburdened, they're tired. They are not following the SOPs which they are supposed to do. All this together is a causal error. Usually, most of the errors what we see is from the doctor, a nurse, pharmacist. It can be in the lab from the technicians or the doctors who are working in the lab. So any one of these people who are involved with the patient may do some mistakes somewhere. Now, as I mentioned, the amount of the money which actually gets spent on any of these conditions. These are most common accidents which are happening in the hospital. As a result, either the patient gets another infection or he dies, or if it doesn't, he'll go out and sue you. Then you get a hell of money from the doctor. Medication error is the most common mistake which occurs. We saw the example of that. Healthcare associated infection. This is again a patient who had come for a surgery and his stay is supposed to be 3 days. If it gets a surgical site infection, which is an hospital acquired infection, it makes his stay to go up to 8 to 9 days. So how much burden to the patient and to the hospital because of the patient is supposed to stay. Now, infections like surgical site is one of them. You have ventilated associated pneumonia. It's very common case, again, especially now with this COVID situation where so many patients were in ventilators. We had so many of these patients. Unsafe surgical care. Day before yesterday, I think, someone in Delhi had sued a doctor for 80 lakhs, and he got it because the doctor had forgotten a piece of gauze piece inside the abdomen. So these are the surgical errors which happens. Now again, if a doctor had left that mop inside the abdomen, all of you say it was doctor's mistake. I said, no, it is actually the nurse's mistake. Because before stitching up the patient, it's a nurse's job to count the number of the instruments and wipes and what all. She had missed it somewhere. Otherwise, she could have said, one of the mops are missing, so it's inside. Stitch it up. So these are the levels of the mistakes and errors which happen. Unsafe injection practice. We have the slides on the next part of the presentation. Diagnostic errors. Again, this happens very frequently. What we are calling it as pre-analytical, analytical, and post-analytical errors which happens in the laboratories. Before the test is started, right from again, writing asking for a wrong test or something like that, that is pre-analytical. Don't do the job properly. wrong performance of the test, that is analytical. And post-analytical, you're in the sleep and you're just typing the report. So you don't know what you're typing. And the report goes something else. Transfusion practice, again, if the blood is not checked properly and transfused, there's lots of consequences. Radiation error. Now, the wrong amount of the X-ray to the patient, exposure of the patient to wrong amount of the X-ray itself harms the patient. So this is another mistake. And sepsis and infection too is very common, very common. In a big hospitals, almost 35% of the patient without any urinary tract infection, they come to a hospital and they leave with the urinary tract infection. 30% of them. So, few sentences just to finish it up. Where is human? Human being makes mistakes. You should know the reason, the complexity of the job which you do, the amount of the work which you do. Lack of knowledge is a part of it. But remember one thing, unwillful error is a miss. But if you repeat it, it becomes a crime. So that is where you will get the punishment. How to prevent it goes back again to the first slide. Now you go through that list and you will see each part of it is a step to stop the patient harm. Okay, the second part, actually this is the lengthier part now, but I will go through it much faster so we can go. I know you are also tired. What is biohazard? So, you remember one thing, the environment which you are going to work with, it's full of the organisms, full of the chemicals which are harmful to you, but only even to your patient sometimes. Now, these biohazards, based on the severity of the disease or infection which they cause to the person, they are categorized to 4 categories. Biohazard safety levels or BSL, 1, 2, 3, and 4. As I said, this depends on the severity of the infection or disease which they cause. Now, most of the time when you talk about the biosafety, you feel it's a part of the technician's job who are working in the lab, you're working with the organisms. That's why they require this type of the biosafety levels and preventive measures for them. But it is not. As a doctors, we go in the hospital, you are exposed to all these biohazard signs. You're touching a patient, you do not know if the patient has HIV. You have a cut in your finger, if the patient blood comes in touch, you have it. They are simple as that. And any stage, when you're touching a patient, you're coming in contact with his blood and his body secretions. So you have to be very careful. So this levels what I'm taking, yes, most of it is used in the laboratory, but the rest of it, a few of them can be used even in the field. What is determining the biosafety level is a list of it. The infectivity, it means how many organisms are need to enter the body of the patient to cause that infection. That is called as infectivity. Severity of the disease, how bad is going to be once the patient gets infected with that organism or once the technician or doctor is going to get it. Transmissibility, how it gets transmitted. Always remember The organisms, the viruses which are passed through the air by droplets, they are more dangerous than the rest. And the nature of the work which we are doing, how you got exposed to that organisms. So these are very important to say the level of the biosafety. We'll see it one by one. BSL-1 is, usually you will see it in the routine laboratories, which the organisms either they do not cause the infection, or if they cause it just minimal infection. So that is BSL-1. This is a requirement for a BSL-1. Individuals should wear a protective dresses, PPE. You should have an access to the hand wash in the lab. And of course, the doors should be closed while you are working in those laboratories. I told you, the organisms usually which you are working with in these labs are not very dangerous. Biosafety level 2, from here on, they are going to be tougher one. The organism viruses like hepatitis B and HIV, they are in biosafety level 2. Our coronavirus is in biosafety level 2, but it makes it more dangerous than these two because you can get it through the respiratory tract. So individuals should have the PPE. Now, the type of PPEs are different. You are going to have it later on in second year. You have to certify that you know how to use those PPEs. Individuals are supposed to have the access to not only hand wash, to the eye wash also. There's a special showers which are kept. If anything happens, they have to just hold their face and the water splash into the eye. And of course, it requires the self-closing doors, preferably with the lock. Today, I think you people were in micro department. You must have seen our COVID lab. You didn't? That is actually BS2. If you see, even the entry to the lab was prohibited. Only with the fingerprint of the few of us you can enter the lab. Not everyone can walk into it. So this is BS2. At 3, we have mycobacterium tuberculosis. Again, everything is same. You have to have the PPE, you have to have the hand wash, but here your hand wash is supposed to be hand-free. It should be foot-operated hand wash. You cannot keep on touching here and there. Your hand wash, your eye wash, both of them are supposed to be foot-operated ones. And here you have 2 layers, 2 doors which get locked after entering the lab. So 2 doors are completely separated. And at 4.1, which you have again a virus like Ebola, the most dangerous one. Now in whole Maharashtra, there are only 2 labs which have the BSL-4. Only 2 of them, both of them are in Pune. So it's not a very simple lab which anybody can walk into. Actually, this lab will be isolated completely. It's not in the main building of the hospital. It's completely separated. Entry restricted only to the people who work. The PPE, they have to wear it beforehand, and their PPE has the oxygen supply. So completely and a space suit is worn, and they're breathing the oxygen. And inside the PPE, actually, it has the positive pressure. So no air from anywhere can enter the PPE. Air comes out only. So the operator can be safe inside. So these are the different levels of the biosafety. Again, remember it, it's not only a lab. Each and every second you are exposed to the organisms in the hospital. Now, later on you will come to know that the organisms which are in the hospital, they are more dangerous than the organisms which are outside the hospital or in the road. Reason to it, the organisms which are in the hospital, they have drug resistance. So rarely you can treat those organisms, or if you want to treat them with use the antibiotic, you have to use the higher antibiotic for that. All right, that's what we call it the hospital strains. They are drug resistant, multi-drug resistant, or extremely drug resistant. What you must be hearing it in newspapers, seeing it. This sign, all of you have seen it, I'm sure you've seen it so many times, but I again sure you don't know the meaning of it. How many of you knew there are different color codes for it? 1, 2 people? None. Okay. Can you tell me? Can you tell me? Is written. But what it means? Where is given caution means what? And warning? Okay. Fine. I'll accept it. I'll give you a mark. When you have the background of the grain, it's not much of the harm. Maintain the hygiene while entering. Wash your hand before entering. This is sort of a notice. The second one, the yellow one, actually these are the one which, again, you must have seen it today in the micro lab. Almost all the lab doors, this sign was there with the caution. This is where we are using it in PSL 2 level actually. The organisms can harm the person, but they may not kill the person. All right. The one with the background of the orange, you have warning sign. These organisms can kill. And usually PSL 3 level, it comes with this sign. And the red one is PSL 4. It means the organisms is kill only. There is no treatment for it. There is no vaccine for it. All right. So these are the different color codes you can see. And most of the time, sometimes we may see this yellow one. Instead of the caution in the top, they have mentioned for staff only, restricted entry. So you can use this sign with your message on the top of it. This is the most important part as far as you are concerned, because you are going to the hospital, you are going to see the patient. This is what we call it as the universal precautions or standard precautions. These are the minimum infection prevention which you can do. Okay, so that's why they call them as the minimum or universal. I'll go through it very fast. Use of these equipments is for two ways. One, you should not get infected. Two, you are not supposed to infect your patient. All right. So for both the reason, you are supposed to have this hand hygiene. Thanks to COVID, everyone knows now how to wash the hand. Anyone who doesn't know how to wash the hand? Surgical washing, huh? I'm not talking about the Amitabh Bachchan washing. Okay. So PPE again, wearing of the PPE. Now once I say PPE, most of you will come, you think you have to go to that whole suit sort of a thing. It's not that. It's a personal protective measure. It can be just a plastic sheet which you're wearing it above your apron. Depending on which area you're working, what you want to prevent. Based on that, you have to wear your PPE. Respiratory etiquette is very important. I'm sure most of you know. Yeah, he did it. Good one. Huh? It's just a sneeze actually. Because nowadays I've seen so many people, he want to sneeze, he remove his mask, he sneeze and he just put it back. The mask is supposed to protect others when you're sneezing, you know. No, he didn't remove it. That was good. Then you have the sharp safety, of course. This is again very important. Safe injection practices. I'm sure during this 1 month continuation of this program, they will teach you the how you do the injection and what are the safeties you have to do. I just mentioned them. Still, the sterilization of your instruments, equipments is very important. And of course, the cleaning of the area where you are working. So we just go one by one through each very fast. I'm also tired. Hand hygiene, all of you know it, but just remember, if your hands is soiled by blood or any body fluid, you have to wash your hands with soap and water. Correct? Whenever you want to wear the gloves, before wearing the gloves, you have to wash your hand. The moment you remove your gloves, you're supposed to wash your hand. Now, in case it is not with the blood or it just touch the environment of this, we can use the hand rub also, not necessary to go for a whole procedure. But again, doing proper doing of the hand hygiene with the alcohol rubs, that itself is very important. You have to learn it. This poster you will see it all over our hospital also. There are the 5 areas, 5 times moments where you have to wash your hand if you are touching your patient. These are all if you don't have the gloves. So before touching, after touching the environment, after coming in contact with the blood and secretions of the patient, and before doing any procedure on your patient, you have to wash your hands. I told you this poster is all over the hospital. PPE, again, it's cover your body. I told you depend on what type of the procedure you want to do. Based on that, you have to decide your PPE. This again in second year will teach you in detail how to wear it, how to remove it, everything, and you have to get certified for that you can do it independently. It's one of the certifiable competencies now to don and off the PPE. So depend on that, you have to, for example, if you have the HIV kit, especially made for if you want to do a procedure on an HIV patient. We have this whole suit which we are using it now for COVID patients. You have all that, so there are different types. I told you it's just on a single plastic sheet. If you later on you'll go to labor room, you will see in labor room everyone is supposed to wear those plastic gowns actually because of the amount of the blood. You can go through all this. Yeah. Now again, remember when you are in the PP, there are certain words you have to avoid. Touching here and there, touching your eye, cleaning your teeth. We have seen a lot of it. So you will see it, then I will laugh. And keep on doing hand hygiene. Keep on doing hand hygiene before touching anything. This is a chart to show you how to wear your PP, how to remove it. Okay? Later on, we'll see it next year. Cough fatigue is very important again. Please don't sneeze in anybody's face. Don't cough in anybody's face. Use your handkerchief. If you have a mask in your face, don't remove your mask. It's very, here, everything is there in the picture. You can see it. Okay? So you don't have anything. You have to use your shirt sleeve to cough. If short, doesn't matter. Cough into your collar. That's This is what you're supposed to do. And be sure, after each sneeze, wash your hand again. Sharp safety, don't worry again. The glasses here and there, you have to have this special type of the puncture-proof containers to put them, so it should not cause any injury to your hand or anybody who's coming close to it. Now, one of the maximum number of the injuries what we get in a hospital, it is where the doctors are using the needles. They take the blood, they pass it into the tube, they want to recap the whole thing, and they pierce the finger. Almost every day, 2 or 3 cases. Almost every day. I don't know why it is so difficult for the people to understand. I've seen the fellow put the cap in his mouth and is trying to recap it. So what to call them, I don't know. So I just show you in a picture. This is what you are supposed to do while recapping your syringe. It's nothing difficult. If you see it, you laugh actually. See, this is the technique. One hand scoop is called. Leave the cap on the bed of the patient or in the table. Just with the tip of the needle, go inside the cap, make it straight, lock it. Everyone is safe. I don't know why it's so difficult for you to remember it. Now let's see, second year I'll ask you to remember what is the name of the technique. Safe injection practices, I won't go in detail with it, you have the whole thing. Prepare your injections never ever near the patient. You're supposed to have a different area to prepare your injections. Before giving the injection, be sure you are cleaning the vials. While breaking the single-use vials, be sure you are not again using these for a crane or shooting the glass pieces here and there on the wall. This is again the practice which most of the residents do here. As far as possible, try not to use one multi-dose vial for different patients. Again, you'll go to what you will see. There is then a vial of, for example, 10 injections. I put one needle on top of it and kept it on the table. Every time you come, somebody just like something, you put it in someone and it goes up. These are wrong. Some of the nurses also, they like in the end of the day, the end of the bottles, they all collected and goes into one single vial and they use it God knows where. These are wrong practices which you are supposed to avoid. Sterilization, disinfection, you will study it in detail. Now, till you are here, we will take care of your sterilization and everything. We have the big CSST, I don't know if they have a visit there. No, they have later on. So you can see actually it's a state-of-art sterilization department what we have. Somewhere opposite ladies hostilities. So you can see them. So instruments what you're using, be sure they are sterile. And once it's used for one patient, do not use it for another patient until it is disposable, of course. Environmental infection prevention, same as you have to keep your area clean where the patient comes, goes after each visit of patient. Those tables, corners are supposed to, sorry? Yeah, sure. So after each patient, you are supposed to clean it.
Was last year in COVID time. So this department was working day and night. Was to explain this RT-PCR and COVID testing facility. lecture and give some type of messages. I will follow the message. And today's proceeding right under the heading A2. Basically, whatever is your result, you will have to save one. 21. This proceeding starts with A2. Immediately after A1, we start with. So the essence of remote migration will Thank you for your patience with me. All the best. We'll see you tomorrow at 9 o'clock.
Ah,